All righty, we are live, everybody. And today is Friday.
Yay, it's finally Friday.
So we are super excited to be over here with the wonderful Michale Chatham. Thank you so much, Michale, for accepting our invitation.
Sure. I'm happy to be here.
We are live streaming it on Facebook. I will have my phone with me.
Good, because I can't see comments, so you'll let me know.
Yes, I will make sure that I'll grab the comments from what everybody is asking questions over here on the chat on Zoom or on Facebook. You guys can type your questions over there and we'll bring them up. I do want to, however, introduce Michale to everybody if you guys do not know her. Michale created one of the first integrative tongue, tie, and oral function centers in the country. Her early paradigms for treatment became an industry standard for collaborative care. She continues to revolutionize the care of orally dysfunctional infants through the Airway Intelligence Institutes Heal the Healer model of patient interaction. The topic today is Each One Be One, a playbook for airway healthcare professionals. Right before we start, I do want to tell everybody this is our last Friday live. All of our Facebook Live / Zoom talks are going into Thursday nights. I will always be streaming them on Clubhouse. So if you're a Clubhouse fan, it's okay. We're still going to be on Thursday nights on Clubhouse, just audio. If the speaker is sharing some visuals, you won't have access to it, but you'll be recorded. I think I'm going to leave it for about 24 hours available for whoever wants to watch, and then I'll take it off the air, and it is for members only. So if you're not an Airway Circle member yet, sign up today. Michale, if you will start letting everybody know, what is your background? Tell us, how did you get here?
Sure. I'm like messing with my screen right now. Okay. So let's see how I got where I am in practice now. So I've been a nurse, bachelor's prepared nurse for 32 years. And I married into dentistry, general dentistry. So I learned that business inside and out. And I was that because of my background in nursing, I took that information and applied it to dentistry. So I used to write a lot of protocols, and we did biological dentistry, and so I wrote office protocols and things like that. And I did work in the office. I did a lot of the business part of office. I also attended a lot of dental practice management and clinical stuff. So I got intimately acquainted with all aspects dentistry. And then and at the same time, I was having children. I'm a mother of 5. I've had 5 children, ages 20 to 28. I don't know how they got that old, but I had them all naturally and breastfed and baby-led weaned before it was called baby-led weaning, and we lived on a farm and a homestead, and we had chickens and grew food and unschooled and the whole thing. And I began having migraines, really significant migraines, quite a few days out of the month. And that went on for about 10 years probably. And I was finally just done with it, and I needed help. And so I immediately went to the dentofacial aspect of that. And I'm like, is it a TM issue? Is it, I was having some other health issues too. And so in the exploration of that, I said, I went to a TMJ specialist, no answers. I did a bunch of other things, no answers. I refused medication because I'm not a medication person. And so I finally went to an orthodontist in town and I said, look, just put me back together, make me pretty while I die. You know, I was being a total drama queen. And so he said, yeah, no problem. We can close the open bite and all that. And I had retractive orthodontics and headgear when I was a kid. And so he said, you've got a tongue thrust. You should really get that taken care of. And I was like, what's that? And so I started looking into it. And this was 10 years ago. And so he said, oh, you need a myofunctional therapist for that. And I'm like, okay, what's that? And so then, click, 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 here we go. So I'm doing all the research, right? And sure enough, there's a myofunctional therapist in Dallas, 6 hours away, and she teaches classes. And I happen to have the educational background and experience to be able to do that. And at the time, I could have even become a COM because of the way things were set up at the time. I decided not to. That's a whole other story. And so I was trained by this wonderful COM in Dallas. And so I took that course and then she treated me and did an amazing job, and my headaches went away. Boom, they were gone. And I started sleeping better and looking better, and, life was getting better. And so, through that, after that, I took another intro course, and then I took another intro course, and then I took an advanced course, and then I taught. And then I'm like, oh my gosh, I've totally fallen down the rabbit hole. And at one of the courses, a PT told me that I had a posterior tongue tie, and I went and I came back from that course all lit up and on fire, about how could this be and blah, 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 la, 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 as we are wont to do when we are in that space of wanting an answer. And so I came back and went to my TMJ specialist, and I'm like, look at this and blah, blah, blah. And he was like, oh my God, please, I don't want to see all this. And so I'm like, okay, fine. So I had my ex-husband release the frenum because I was fully prepared and I had all the best care at the time. And then several weeks later, I'm in the hospital with a ruptured appendix, a collapsed lung, and fighting for my life. And I have sepsis. And then I'm like, at the time, I didn't quite put those two things together. And then after I came out of that situation, I had 13 holes in my abdomen. I'd had 3 surgeries. I lost 30 pounds. And it changed my life. And I'm like, oh, everything really is connected, and connected in ways that I wasn't even really fully aware of. And so I spent the next several years climbing back up out of that hole. And then after that, well, even before that, I had begun to treat my patients completely differently, because I was beginning to see these kinds of connections in infants and the radical, massive changes that can happen when we treat infants through this lens of, oh, look, let's support lactation. Oh, look, let's support their structural integration. Oh, look, let's even during the procedure help them open and do integrative work in the chair in the midst of this procedure. And let's do it in a way that absolutely expands their consciousness. So I had been doing that for a while. And then I had my own experience with it. And so then I really began to change the paradigms and the sequencing of care and the ways that I was doing things. And so after I got divorced, I moved, and then I started my own practices and had fly-in, drive-in clients who were not getting their results from having had a procedure done. Then I actually began to streamline the way that I recovered myself, and began using that as preparation for the procedure. And then I began to start helping professionals. And then I learned, oh my gosh, even as professionals who are in this field, we still have things that need to be worked on or want to be worked on and let go of and sort of untied, so to speak, even in our minds, in our families, in our beings, in our bodies. How do we do that? And so I began to teach healthcare professionals how to do that. And I really became passionate about the care of the caregivers. What? Who knew we needed care too? We do. We need the most, actually. And so that's why I kind of landed on each one be one and the playbook, not the rule book, because as you know, anytime there's a new paradigm on the horizon, the first thing we try to do is create a table of contents and an instruction manual and a new box. So we think we're out of the box, but all we've done is really create a new box. And so there's a lot happening outside of that box. And so I like to play outside the box. So that's where that came from. Did that answer your question, how I got here?
Can you elaborate a little bit more?
I don't know. Maybe I can. Let me take a sip of coffee and see if you have any questions.
This is fantastic. What an amazing story. And you were so right. As caregivers, we give so much. We give all the time. And then you add on top of that, most of us are moms. My goodness, we are being pulled in so many directions. So I cannot wait to hear more about your program and what else you have been doing for people and you can do.
Well, you know, the interesting thing about it is, like, I guess it's been, what month is this? September. 2 years ago, I went on a HUNA spiritual journey in Hawaii, in Kauai. And that's where you kind of pull through Hawaiian spiritual principles into your business, into your everyday life and things like that. And I came back from that trip and I had one of those moments where I'm like, oh my goodness, I'm supposed to go back. Never wanted to live in Hawaii, never even really wanted to go to Hawaii. And I came back from that trip and I said, I'm supposed to get rid of all of my belongings, close my practices and go. I don't know if this is a detour or a destination. I just know that I'm supposed to go. So I came back from Kauai and I gave away all of my possessions. I literally did not even have, I think my yard guy got most of the contents of my home. And I don't even really know what happened to a lot of it. I just said, give it away. And I'd have people over and they'd leave with carloads full of stuff. And, you know, anyway. And so I came to Hawaii and then one of my kahunas had challenged me several years ago. She said, you need to teach people what you know and what you do. And I was like, me? You know, I enjoyed doing structural integration work on babies. And I enjoyed the whole aspect of consciousness with these children, watching them blossom and grow and really show up in new ways and show their families their true gifts and their true selves. And it was it's an amazing process. And I love that. And I'm like, okay, my challenge is to teach people what I know and what I do. And what I realized in that process, Renata, was that it's all about power. It's all about your internal power. And what I realized was that most of the time what's happening is that when a client or person shows up and they've got a small mouth, narrow palate, malocclusion, there's always the structural piece, right? The posture, blah, blah, blah. That this is a state of collapse. So, well, why are they collapsed? So I'm the 3-year-old. I'm like, well, why? Well, why? Well, why? Why that? Well, why don't we talk about that? Or why don't we I want to do that. I want to talk about the other stuff. I don't want to talk about this stuff. I want to talk about the why on the bottom of the foundational why. Well, how did we get here? Well, why is this happening? Well, how do we reverse it? Well, how do we make it so that they're collapse proof? Ooh, well, there's a concept. How many times do we see orthodontic relapse, right? That's collapse. That's a state of energetic collapse. So what I started teaching was, I'm like, okay, so in the presence of the people that we've chosen to help us, that now we've entered their field. Well, that person that I'm going to for help, I'm like super picky about that. I mean, I want them to look like they've got the kind of health I want, right? I want them to represent the kind of energetics that I want to possess. So if I'm going to go to a business coach and I say, okay, I want to have $1 million year, I'm not going to go to somebody who's making $25,000. I'm going to go to somebody who's making $10 million, right? It's the same thing with our healthcare professionals. If you're going to somebody because you want vitality and you want health and you want mental clarity and well-being, then that needs to be repped in your practitioner. No excuses, people. Like, no excuses. So then I started looking around at the leaders in the field, and I'm like, ooh, we're in trouble, people. I'm sorry, we're in trouble. There's things here with on a soul level of expression that need help, that absolutely have to come up from the ground, up through the being, out like light coming out of every pore of our being, so that we can experience this type of power and vitality. And it's not going to get there just by widening the palate or getting the tongue up or maybe fixing the occlusion. This is a power issue. So I set up what I teach in the form of a triangle, and there's a foundation, and there's actually, the human is the most fun to deal with because the human operates off a natural law. Hello, there are certain things that have to happen in the human for the human to grow and change and be. And so that has to come online, but we're not talking about those things in airway dentistry. Some people are beginning to, like, oh, well, you need to chew, or we need to eat different foods or whatever. Yeah, that's true. And yet our ancestors, at the African Rift, and if you're with the evolutionary flow, slurped oysters out of shells. They didn't chew. They were slurping oysters, and that's how they got bigger brains, and that helped change the head, right? So this is evolution of the human head, right? So back on track is, where do we get our power? Where do we get our ATP? How does our DNA work? How are our mitochondria healed on that level of expansion so that we become integrous and tensegrous, and we hold a frame that supports all the work that we're doing in this area? So there's that piece. And then the other piece that I got interested in was, okay, posturally, how does the brain train the frame? And it starts in infancy, right? And it's a hindbrain story. It's how does the body want to interact with itself? And these are the things that we've lost because of captivity and domestication and computers and stuff, right? Because we're so far removed now from the natural environment in which we created. And then the other piece that I'm incredibly impassioned about is the whole perioperative experience of releasing the frena. There's actually a transformational piece that is potentially there for someone in that surgery who wants it. You can literally come up out of that chair a different being if you have everything in place. And it's a consciousness piece. So that is how I developed that whole kind of foundation to triangle, up to the pinnacle piece of doing that. And then I started mentoring healthcare professionals who wanted to play in the Olympics of airway.
I love it.
Yeah.
And you still see patients?
Very exclusively. It's very bespoke. They have to find me, and they have to tell me why they want to see me. I don't treat just anybody. Yeah.
I do have a question about that. Let's say that you do get a patient who needs a frenectomy. What is the pre-work? Before you even consider them going through that, because of course there's no standardized, myofunctional therapy course, or how things are, and because we're all different individuals. But all of us do it differently because we all have found a way that works better for our patients. But since you're looking at so much more and going so much more in depth, making sure that person is ready for that release, what does time frame look like?
It's totally patient dependent. So how decompensated are they? How collapsed are they? How how disempowered are they? This one, I'll give you an example. Like I was at a very big, I was speaking at a conference, and it was a biological dental conference, and this was a few years ago, and they wanted me to talk about myofunctional therapy. Okay, fine, I'll talk about myofunctional therapy. And so, before the talk, the in the back of the room was a large laser company set up, and they were doing palatal lasing for snoring, and we all know the names of these things, and so I'm being very general. And so there was a doctor there who was actually going to speak and rep this laser, which also had the capability to do soft tissue, which for frenectomies. And so he was demoing soft palate lasing on this one female dentist, and then he looks in her mouth and says, "Oh, and you've got a lingual, you've got a tongue tie, and I can take care of that for you next weekend." I'm like, I'm losing my shit. Oh, are we allowed to cuss here? I'm losing my shit.
We are. Yeah,
I'm losing my shit. And I'm like, oh God, fuck, here we go, And so and he points at me and he says, unless she says that you need myofunctional therapy. And I was like, oh, and so please, don't pander, don't, And so I walk away. I'm going to go have a drink or something. I don't know. And she comes over to me later, and she wants to talk to me, about it. And the first thing I start talking to her about was her posture. And I said, and I just start asking her questions. I'm like, how do you feel if you stand this way? So I take her through a couple of little like postural blueprint method things, and I'm like getting her to activate her back body and do some stuff. And she said, I feel like I am, oh wait, I got to find the words. I feel like I think too much of myself. I was like, oh, our problem here is not a tongue tie, people. Our problem is that even if she's given the freedom, she is not going to step into her full self. So, and I told her, I said, okay, Dr. So-and-so, you are young and beautiful. You have everything going for you. And I'm telling you right now, if you have that done, you're probably going to end up worse off than you are now, because you have got to get to the point where you can open your heart and step into yourself. So I don't do time frames. I would take her back to, let's talk about why you cannot step into yourself. Now, people might say, well, that's psychology and blah, blah, blah. You know what? No, sisters, this is like, come on, this is like, you've got your whole future ahead of you. And this is not about a tongue tie. This is about you being able to step up, hold yourself, create some space, take up some space, and be present. And then let's talk about your frenum. That's what I'm talking about, the heal the healer model, is how is she going to take anyone else through that process and get that kind of outcome that's going to last and not collapse in that way.
That is an awesome explanation, which brings us to my next question. How do you think that your background as a nurse, am I muted now? Your background as a nurse has helped you see this? Because most people in this field are either speech pathologists or dental hygienists. And we all know that whenever we look at the patient, we're all looking at the patient so differently. How do you think that your background as a nurse and everything that you education wise, until that point has helped you be able to see the patient, as a whole?
Yeah. So in nursing education, we're taught all the systems of the body, and we're taught systematic thinking called nursing process. So we nurses are by design, we're programmed for risk management. If something's going to go wrong, we'll be able to find it, because it's all about risk management in nursing. You don't upgrade a patient's level or downgrade their status unless they have the skills to be able to do something. That's liability. And so when I take that and I look at tongue tie and the number of people that I have had discussions with after release that have actually gotten worse is alarming and startling. And so what I began to do, and even through my own experience, say, oh, wait a minute, okay, what's getting ready to happen in the body here? Do they have the neurological and physical stability and skills to be able to handle what is about to happen to them as far as this type of freedom? Can they hold it in their bodies? Are they stable? Are they mobile? Are they agile? Do they have the neurological capacity to operate at this higher level? Because I've always said, this is a hardware-software mismatch is what this is. So we've got the operating system that has the capacity, and the hardware looks like this. So when you begin to change the hardware, does the software have the capability to run the hardware? Is the hardware going to outperform the software? Do you need a software upgrade? That's all your neurological stuff. So where are you in calibrating the hardware and the software? So in nursing, what we do is, there's an assessment, then there's a plan created, and it's called a nursing care plan. So there's a nursing diagnosis made. So nurses are taught to diagnose within their scopes, and so we're not going to say, oh well, activities of daily living today, include being able to shower. If that person can't walk to the shower, you know what I'm saying? So it's that frame of mind in the training that helps you look at it. You can take that frame and you can apply it to anything, dentistry, speech. It doesn't matter. It's just it's the lens. It's like, here, use my glasses. So, and then also just the anatomy and physiology, the systems, all the things that go with a higher level training in a field. Yeah, in nursing.
Amazing. I have a question here from Anne, and you touched on this a little bit already with this last question that I asked, but I'll ask the whole question to see if you'd like to elaborate a little bit more specifically to what she's saying.
Okay.
She was asking, what does your work look like as a clinician, and what is the triangle that you were referring
A triangle is, I call it the pyramid of stability. So on the lower level, I have a program called Power to Change. The middle level is the postural blueprint method, which I apply to primarily infants and toddlers. It also has a big adult application, but I teach it through the lens of the infant and the toddler. The top is the perioperative experience. So that's what we actually do pre, intra, and post-operatively to fully support this person in stepping into this software hardware calibration. So that's the pyramid of stability. That's like the frame and the lens through which I teach content, and I have people engage with it as transformational coaching. So you don't come to me for another like snort of cocaine, continuing education, weekend warrior course. We go to boot camp. That's what we're doing, because I want you deprogrammed and reprogrammed and operating in your own intelligence, knower, and genius when you move forward. I don't want you just like throwing up what somebody else told you. I want you embodied and fully engaged and present 360 and operating through all of your knowers, all of the way that you feel, the way you see, the way you know. So there's that. What was the other part of the question? The beginning part was about practice. What
how do you practice as a clinician? And I think you touched, what does it look like?
Yeah. So what it looks like so now what it looks like for me, because people come to me when they haven't got their outcome and they know that there's something that's still there for them. So in the Facebook success groups, I call them success groups, not support groups, because the people who have had the kind of experience that I have had with me personally, they're not in those groups. They don't hang out there. They're not welcome there because we're the turds in the punch bowl. We don't, it's not a fun day when somebody shows up in a support group and say, well, I almost died. That's a fun time. Yeah. So no, we're not those people. So those people who have been through release and maybe got a little bit of a result, and maybe they got part of what they want, but they really don't know what else to do. Or they got a very untoward outcome, like shit really went sideways, or as my friend Angie Lehman says, tits up. I mean, that shit went tits up. And they're like, oh my God, can I just get back to zero again where I was? I'll take that all the shit I was in before if I can just get up out of this. So those are like my people. Those are the people who come to me. And it's funny because even here on Maui, I've had two little Maui, two people who have done functional frenuloplasties who did not get their outcomes, who they're like, thank God, because I'm worse off now than I was before. And so I'm like, okay, let's get you back together. And so you attract what you are, and I was hot mess. And so I would get, hot mess, but people who did not really want to be hot mess, they really want to get better. And so that's kind of the people I attract. And then also, like, there was one other thing I was going to say about that. Oh, the other thing I've noticed in the success groups is people that have been in this field long enough. Like I'm an algorithmic like stalker tracker. Like I kind of watch like, okay, how is it at 1 year? How is it at 2 years? How is it at 4 years? What I'm seeing is that people generally have reported that the release and the relief that they felt after a tongue tie release lasts about on average 4 years. And then they're kind of back to where they were. And I'm like, oh, fascinating. Why is it just that they're getting that amount of benefit or result? Because their capacity is diminished now, and they're going back into that space of, I'm really about the same as I was previously. They've collapsed again. So for people that find me are the people who still have that shred of hope that something can be better, or they're hot mess express and they need to turn the train around. That's generally, so I don't usually see people who are like, the other people that usually find me are, I've been told I have a tongue tie and I have all these issues that resonate with tongue tie. And I have this gut feeling that this is something different. And I want to work that out. And so then we get going.
Fantastic. You mentioned, especially that lady that you met at the conference, that she was going to be, worse off after she got her frenectomy. What types of issues are these people complaining about that it gets worse? And can it be fixed after? I think you just said that, yes, it can be fixed after, but what types of issues do you usually see that get worse?
Yeah, so the tension will be worse. So the tension that they thought that they were going to get rid of is worse. Um, in the, I was going to say, in the clubs with the secret handshakes, um, where certain people have circled the wagons, and we all know who we are. Where people have gotten a very deleterious outcome. I'll see things like people fall. So there'll be people that really neurologically they're very unstable. I look at my own situation and I was like, wow, I had no idea that level of pre-existing decompensation existed in me, because I look so damn good. How could I have possibly been that how could I have possibly been that messed up, or that such a hot mess on the inside? But once you drop out of that sympathetic dominance, and your body is like, does not know what to do with that. It doesn't know when to stop falling apart. It's like, and so these are the people who their body doesn't, they're free falling. Their body does not know how to regulate and to create this stability again, because they were literally so jacked up. Now they've fallen down into this parasympathetic and they're like free falling.
This is so interesting you say that, because, I've been doing my functional therapy on myself for 5 years. And I went to the chiropractor not long ago, and they did this test to see, what's more, if our sympathetic system and our parasympathetic system, what is,
Mhm.
you know, on the most right there. And I'm like, I got this. I got my breathing on. I'm nose
Yeah, girl, you're
bleed.
like,
I'm
I've done my
calmly
stuff. Yeah.
all sympathetic. And then Dr. Bahar did mention it, that it could have to do with my posture, because I'm checking all the boxes that, from what you're saying. Forward head posture and the shoulders rolled forward, that automatically puts you in a sympathetic tone. But it's because, I can't breathe. If I stay back here constantly, my gosh, I will not be able to breathe. Why do you think that getting a frenectomy will trigger this snowball effect of unleashing, what's stuck inside of us?
Yeah. So, years ago, I wrote an article about that to help parents understand what's happening with that in infants, because I've seen infants who have gotten, I see this how many times. If you work with infants, you've seen it. You've seen the infants who completely decompensate after a release. The article was, "Is your baby a tether flower or Tetherberg?" So it's Tetherberg syndrome. It's that all the stuff that's going to sink the Titanic is the stuff you don't see. And so, as practitioners, in order to practice, we almost have to have some of this going on, because whoa, what do we do with that? So we kind of have to do this, and it sets us up automatically for and our Western system, our constructionistic system is set up that way. Specialist, scopes of practice, licensures, blah, blah, blah. Everything that limits us from being able to have this 360-degree view is working against us in the Western allopathic system. That's what, welcome to America. And so, that's one of the big issues is that as practitioners, to feel safe and to be in our lane and all that, we kind of have to do this. But a lot of what those things are other issues. They're spiritual, they're emotional, they're genetic, they're epigenetic, sometimes we're carrying stuff that's not even ours. It's our lineage, it's our history, it's rooted in indigenous trauma, it's rooted in all the things that we're not trained or allowed to treat. but yet they affect our outcomes. It's all there. And so the people who go in and have a release and the angels sing and the planets line up and, oh my gosh, it's the most wonderful thing ever. Everybody should do this. That's the tether flow. It's just, they just had this one little thing and they didn't have the Berg issue that was going on. People like me who go in and do it and damn near die. I mean, that's a lot of Berg, it's like, but would anybody have known to really look at that point? So when I work with practitioners who want to practice at this Olympic level, kind of, I call it, they do it for themselves because this is who I am and this is what I needed for myself. And they create ways to bring their clients and their patients into this kind of whole integrated state of being. It's literally coaching for your clients. It's like what health coaching has become to allopathic medicine. What I'm talking about is like health coaching in the myofunctional airway dentistry realm, because you can only treat at the top of the pyramid for so long. Eventually, if you don't have a foundation to stand on, you're just peeing in the ocean. And it's like I tell people all the time, these kids now, by the time they get to high school and get out of high school, they got a freaking college education in their mouth. The money is like off the freaking chain, right? So what are we doing? How are we not teaching these kids to be powered up, heal the mitochondria, set their spirits free, do the things that the reason that they're here on the planet, those kinds of life-giving, pulsing kinds of things that are not just about the shape of their palate and how their teeth fit together. That's part of life force that actually helps create the space. So I always go back to create, utilize, and maintain. And people are like, why are you talking about cum? I'm talking about cum. This is Latin. This is with. This is create the space, utilize the space, and maintain the space. It's a self-perpetuating system that is the antidote to collapse. But unless as a practitioner you're doing that, then, come on, you're just perpetuating literally the belief that we're all doing this for the money. But if you're really doing it for yourself, it comes out of every pore of your being. It's in your field. People get to you and they know they've just encountered something at a different level.
Wow.
Yeah.
Oh my goodness, this is amazing. Well, who else do you have in your multidisciplinary team that is different than I would, for example, since I'm not, looking at things the way that you are?
Okay, by the time someone gets to me, they've already seen
everybody.
If they've got a license, they've seen them. At this point, we're talking about sovereignty. So all of the things that they've gotten from the best people that they've seen, now they can put it into a perspective of sovereignty. This is the final frontier of your story of becoming self-sustaining.
Definitely.
Because it's not about who's going to treat you next.
Mm-hmm.
This is about your mind being free of everything that you thought was, and now you have all of the tools in your toolbox to be able to create, utilize, and maintain yourself. It's not about who you're going to see next. Most of the time when people get me, they've seen everybody. They've done all the things and they've seen the best. And that's beautiful. That's awesome. because it's always, now it's about the outcome behind the outcome. It's what they say they want, and then there's something behind it.
And it's all a journey, and sometimes they have to go through all of those, and they are gaining something from seeing all of these different professionals.
Yeah, it's not empty. Yeah.
The longer people stay in this state of dysfunction, do you notice that it's more difficult to bring them back? So, for example, if you're going to treat a child, which, my goodness, there's so much more that can be involved in a child because they are in a constant, in somebody else's house, having everybody else's parents and teachers and whoever else, what's going on in their lives. They don't have full control of who they are per se. But do you feel like a young person, it's easier to get them out of this dysfunction than somebody who's dealt with it for a lot longer?
Yes and no. It's so situation specific, right? So children, I love working with families. It's so amazing to watch families allow their children who show up with, I call it the gift. This is the gift. Everybody thinks it's the problem, but no, it's the gift. Because when you get to engage the expression of what's going on, and you allow it to have its transformational effect as the gift, many families' lives completely change. So what's an example? Okay, so let's take breastfeeding issues. Okay, so baby comes in, there's breastfeeding issues, and the mom wants the tongue tie release done because when she gets the tongue tie release, all this is going to go away. And then what? Because she wants something on the other side of that. What is it that she wants? So she wants something. So she's gonna go through this. She's gonna have this experience with this tongue tie, with this breastfeeding issue, and then it's gonna go away. And then she's gonna get something, or she's gonna do something. The families who will stay still and still stay in the midst of it and let it absolutely transform them. They're having to be still. Families don't be still right now. They go, 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 go. So if they can be still with it and ask the questions of what's here for me, what's here for us in this situation, the families who get to that answer, their whole lives transform, because those people in my field, in my practices, they go get connected with nature. They go get connected with each other. They start looking at their baby as this gift of a message that, if they'll hear it, will absolutely transform their lives. And that's the fun stuff for me.
I can stay here all day and talk to you.
Oh, are we done?
No, not yet. We have a couple more questions, but we're getting to our time, and I'm like, no.
Okay.
Anne has a question. She said, how can dental providers learn how to make a more holistic assessment of their patient to know when they are ready for a frenectomy? Take your course.
It depends on the practitioner, because there are dentists. Okay, so this is the this is the stuff that gets you dismissed from teaching. Okay. Because
you don't have to go there if you don't want to have another.
Yeah, I actually really love to go there, but we don't have time.
Exactly.
And so that's actually one of my favorite things to talk about. There are all kinds of frenectomy providers, all kinds. And I used to, when I taught at at University of Texas, I used to say, you know what, if your purpose here is to be Dr. Whacker, and you're the best frenum whacker out there, and all you're going to do is whack that frenum, then fucking whack that frenum and do the best damn job ever. Awesome. Great. Don't try to be holistic and integrative. It doesn't work for you. Stop it. It's gross. If you are holistic and integrative and you want this, and when I help people, I have a program I do called Practice Genesis, where doctors they actually want this, and they're like, I don't even know how to do this. And it's not that they just want to refer, they really want to understand, they want the experience, they want to be transformed themselves, right? So I have a program called Practice Genesis where we do this. And actually what that does is understanding and knowing the people that they're referring to create this integrative care. Their lives get so much simpler, and then they're spending so much less time with patients, and they don't have to think about those things because they've got people that they're referring to that know exactly what to do. They know exactly when they're ready, and the doctor doesn't have to think about those things. They're not having to make those judgment calls because they've got top-notch people who are looking at these things and know exactly when to pull the trigger. That's my answer.
Amazing. I have 2 more questions, but we don't have time for both.
Okay.
So I am going to ask you both, and then you pick one.
Oh.
Or no? Okay, let's just talk about buckle ties then.
Like,
let's talk about buckle ties.
Okay. Oh, buckle ties.
The whole thing. I've been wanting to have you here so you can tell us.
Well, girl, why don't we ask that question? Why don't you ask that question first? Okay, so
I know we should have been first. So give us a little bit.
Okay.
And we're gonna have to have you back, or maybe we'll do something special just for members. For you to come back and give us some more. But what made you first want to look at buckle ties? What made you go, why are we not?
My 3-year-old totally was like, well, there's 7 attachments. Why are we just looking at 2? And so, this is a really great story, actually. So, God, how many years ago was that? Close to 10 years ago? I don't know. I had flown up to visit Sharon Valone and Jennifer Tao, and Jennifer and I were working with infants and actually creating some of the oral work that became the foundation of her IBCLC masterclass and baby myofunctional therapy. So that was like the seed of that, And we were looking at this one baby who had lip and tongue, beautiful job, famous practitioner, did the release, beautiful job, and the baby's still dribbling milk out of the side of his mouth. And the baby had feeding therapy and seen Sharon, masterful chiropractor, body worker, the queen, the godmother of baby body work, the best, right? And so I'm partially feeling and following, and I'm like, oh, this. Let's look at all. And I always screen and assess all 7 attachments. There are 7. Screen them all. Document it, and the impact that it has on function. That's how you know if you release a buccal tie, a buccal frenum, not if it's a buccal tie, if it's affecting function, right? And so it was a low attachment on the gingiva, and the baby didn't have any orientation to the midline. And so could not move the nasolabial fold toward the midline. And I'm like, this needs to be released. And so she calls said provider who was on the golf course and said, hey, can you do this? And he said, okay. And so he did it. And then boom, the baby's got orientation toward the midline and stops dribbling milk. And so that is a functional piece to the buccal frenum in the baby. So being able to ask the question, does it have a functional impact? How is it impacting? Is the frenum the source, or is it something else? And you unpack it, you do your detective work. Because yeah, there's a lot of buccal frena that are low attachment and flag and all of that, and they're really not having a functional impact. Now you might feel it cranially if you know how to assess Schneiderian ligament or across the cranial base. You might be able to assess those things, and then you might go, oh, okay, yeah, that really does need to be released so that we can get rid of a cranial strain pattern that might become malocclusion later or something like that. But that's like kind of next level assessment. I mean, not everybody's going to be like, oh yeah, blah, 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 but that's my world. That's my brain. Right. So I use the classification system for every single attachment, which is where does it sit on the gum line? The tension, the turgor, what's it connected to, and document all 7 of them. Why wouldn't I? There are 7, not 2.
I love it, Michale. This has been one of the easiest talks and easier ways of coming up with questions because you just give so much. Thank you for being here, for spending this last hour with us. If anybody has any questions, I am sorry, you're gonna have to wait until next time.
So let me just add, if you are, most of the people who end up mentoring with me, they're fucking done. They're fucking done with what they've experienced, with how their practices are going. They're really kind of ready to, they want to give up. They're done. They're like, I don't know if I can keep doing this. And if you think you're that person and you want to play Olympic level stuff because you're ready for an upgrade, you're ready for an up level, and you're ready to get 360 with this whole thing, I've got a link tree on my Facebook. I've got link tree on my Instagram. There's an application you can fill out. Nobody just gets to come in and take my classes. That's cocaine bullshit. I don't do that. If you want to come in and you want to transform your life and transform your practice and up level and upgrade, those are the people I work with. And you can fill out an application, and me or my salesperson will get back in touch with you and we'll have a conversation.
Perfect. I will post your link tree on our private Facebook page. So those of you who are interested can get to it easier. Thank you. I can't say anything else. Thank you. I am so grateful, Susie, and everybody's sending messages over here saying how appreciative they are. Everybody have a wonderful weekend. Starting next week, we again are no longer having Friday lives because we're starting to do courses now, Fridays or Saturdays, once a month. But we decided to take that one out to give us a little bit more time to focus on these courses for you. And also, we are working on our podcast. Our podcast is going to be super different than other podcasts out there, and I'll share more about that soon. But the name of the podcast is Airway Circle Radio. That will give you a little bit of a idea of what we're going to do with it. If you guys have any questions, anything. Oh, and we're not going to do anything on the weekend, the week for the AAPMD, because Angela and I will be in Atlanta, and we're going to go live from Atlanta. So we don't have anything, scheduled. We're just going to have fun and hang out with everybody and show what we're doing. But thank you for everybody who attended, for all the messages. Michale, you're wonderful. I cannot wait to go back to Hawaii just so I can come see you.
Please come see me.
I will. Thank you so much.
We'll go smoke a cigar on the beach.
Let's do it. All right. Bye, everybody. Thank you. Bye-bye.